So hello, everyone. Thank you again for joining us. My name is Michelle Doshi. I'm an adult services librarian here at the Lake Forest Library. And today we will be talking about how to pick the right plan and get the best rate for Medicare supplement insurance. And we're going to talk a little bit about how to use the Medigap tool in the library's Weiss Ratings database. So keep an eye out for our summer newsletter. We do have summer reading coming up starting in June, which is only about like a month and a half away. It's coming up, believe it or not. You can also go to www.lakeforestlibrary.org/events to view and register for any upcoming events that we have. Just a few housekeeping things. When you joined this talk, your microphone was automatically muted and your camera was automatically taken off. But if you wanted to have your camera on during this recorded event, you're more than welcome to. I just ask that if you have any noise in your background that you please keep yourself muted. So we will have a presentation, and then after the presentation, we'll have a Q&A where I will stop the recording and so you can ask your questions without being recorded. So if you have any questions between now and the end of the presentation, feel free to get them in the chat. And then I can read them out during the Q&A portion. And then once we get to the Q&A, feel free to come off mute and ask your question yourself if you would prefer to ask it that way as well. So with that being said, today I have with me Tom Kilkenny. He's an account manager at Weiss Financial Ratings. And I'm going to let you, Tom, introduce yourself a little more. Thank you again for joining us today.
The pleasure is mine. Welcome everybody this evening for the Medicare supplement insurance and how to pick the right plan and get the best rate with Weiss Financial Ratings and of course the Lake Forest Library. My name is Tom Kilkenny. 28 years as a wealth manager. About 2 years ago, I decided to pump the brakes on wealth management, sell my practice, and I've been with Weiss Financial Ratings, Gray House Publishing now for some time. And what we do is we provide online databases for wonderful libraries like the Lake Forest Library that provides these services and this information free to you, of course. I am fully licensed. I could give advice all day long. However, I will not be giving any advice today. I'm not licensed with Weiss Financial Ratings to be able to do that for you. But what my responsibility is this evening, and I will do it with a big smile, is to be able to provide some great information for you and show you how you can go into the Lake Forest Public Library and access this free information where you can actually shop for Medicare supplement insurance, which you know, a lot of people tend to need, especially in this day and age. Exactly what was mentioned, we'll wait until the very end for a Q&A. I would highly recommend that the chances are a lot of your questions are going to be answered throughout the PowerPoint presentation. We've done a very good job with trying to capture a lot of information for you. So hopefully a lot of those questions are actually answered throughout the presentation. If not, please, as you go on, just add those to the chat. And at the very end, I'll be more than happy to answer any questions that you may or may not have. Okay. So without further ado, I am going to go ahead and I just want to make sure that everybody can see the screen that I have displayed. If I could just get somebody to respond that they can see the screen so that I can move forward.
Yep.
Awesome. So, all right. So the Medicare supplement insurance, how to pick the right plan and get the best rate. And we'll share a few Medigap secrets that might save you a bunch of money too. Okay, Medigap pricing tool and insurance ratings. It's Weiss Ratings and Gray House Publishing. The one thing that you can definitely, what you'll receive from us today is independent information. It's going to be unbiased and it's going to be accurate. Weiss Financial Ratings and Gray House Publishing have no affiliations with no other company whatsoever. So you're absolutely going to get independent, unbiased, and accurate information this evening. The Medicare and Medigap discussion is designed to help you navigate through the Medicare maze, and that it certainly is. Our primary goal is to tell you about the choices you have available to you and help you save as much money as possible. At the end of this talk, you'll be able to download your own customized Medigap report that can help you find and select the best Medicare supplement insurance policy for you with the strongest companies for the least amount of money. And you can do it for free simply with your Lake Forest Library card. Here's what we'll cover. Major expenses, Medicare does not cover. We'll also cover when is open enrollment and what does that mean to you? Why Medigap can be better than Medicare Advantage. How to get lower premiums, save hundreds and even thousands of dollars. When can you join Medicare? Typically, a 7-month enrollment period is 3 months before your 65th birthday, the month of your 65th birthday, or 3 months after your 65th birthday. Open enrollment period begins October 15th to December 7th. Still working and covered by insurance, Medicare can supplement your employer coverage as well. When can you change your plan or your insurer? If you have Medigap plan now and want to change your plan or your insurer, you can do so during the open enrollment period each year from October 15th to December 7th. Your coverage will begin on January 1st. Understanding Medicare coverage. You have Medicare Part A, which is your hospital insurance. You have your Medicare Part B, which is your regular medical insurance. There's the Medicare Part C, if you have it, the Medicare Advantage. And you have Medicare Part D, the prescription drug coverage. Medicare Part A, it covers hospital-related services and emergency care, inpatient hospitalization, home health services, skilled nursing services, hospice. Medicare Part A does not cover all of your hospital costs and does not cover long-term care. It's very important. Not sure if everybody has their microphones muted. Okay, awesome. Thank you. Medicare Part B covers your regular medical care and helps with outpatient services, maybe like your doctor office visits, laboratory visits, ambulance, diagnostic services. So you might be thinking you're totally covered with your Medicare. I mean, it certainly seems that way. Medicare does not cover all of the costs associated with hospital and medical insurance, and it does not include prescription drug coverage. These are some really easy to view Medicare out-of-pocket costs for 2022. These are numbers that were ran independently and are very accurate. Without Medigap, these are some of the out-of-pocket costs you may need to pay. Part A hospital deductible is $1,556. Part B annual deductible is just $233 for the year. Most outpatient service and medical supplies are 20% of the total amount Medicare approves. Part B monthly premium is $170.10. And again, that's all dependent upon your income. The Part A hospitalization covers days 61 through 90 is $389 per day. Part A hospitalization days 91 through 150 days is $778 per day. And then skilled nursing facility care days 21 through 100 is covered at $185.50 is what you would be responsible for. Now, skilled nursing facility care after 100 days, you're responsible for 100%. Hence why the gap insurance is very important. Other hidden costs of Medicare. None of these things are covered. Prescription drugs, vision, emergency care abroad if you like to travel, dental, and hearing aids. These are 5 items that are not covered under your Medicare coverage. You have choices and individual needs will vary. When Medicare was established in 1965, it was never meant to cover all of your medical care for your senior years. It was intended to cover only the most basic of needs. You have choices in regards to your health care. You can stick with Medicare Part A and Part B, or you can purchase additional coverage. You can make this decision based on your unique healthcare needs. 2 choices to fill the gap. You have the Medicare Advantage Part C, and then you have your Medicare Supplemental Insurance Medigap, is what we're speaking about today. Medicare Advantage Part C coverage is provided by private insurance and is limited to a defined network of doctors and providers. It combines Part A, hospital insurance, and Part B, medical care, and oftentimes Part D, prescription drugs. Medicare supplement insurance, better yet known as Medigap, covers deductibles, it covers co-payments, and covers co-insurance. It's designed to fill in the gaps that Medicare Part A and Part B does not cover. These are some common things that are covered on both Medigap and Medicare. Medigap, original Medicare and Medicare supplement, higher premiums, but no copays, freedom to choose doctors, no referrals are necessary. Some routine services are not covered, like vision and hearing. It's not covered through Medigap. And you're covered anywhere in the US, and 6 plans offer coverage abroad. Now, the Medicare Advantage generally has lower premiums, but it has copays. You may be restricted to a network. You may need referrals to specialists. It may include extra benefits like vision, hearing, and fitness, gym membership. Outside of your service area, you're only limited to emergency services only. Okay, secret number 1. Medigap plans offer identical coverage. 10 Medigap plans. There are currently 10 Medigap plans, each known by a letter A through N. And 2 plans, F and G, each have additional high deductible options. For every lettered plan, every insurer that offers this plan provides the same exact benefits. The plans are regulated by the government, so the coverage within each lettered plan is the same, regardless of the insurer that you choose. That means all Plan A's have the same exact coverage. All Plan B's are the same. All Plan F's are the same, and all Plan G's are the same, et cetera, et cetera, et cetera. You can pick the plan that has the coverage that you want. You can compare one insurer to another. You can pick the plan that has the best rate. Questions to ask yourself when picking a Medigap plan. What's your income? Using a customized Medigap report, you can shop for a Medigap plan that has the most benefits that will fit within your budget. Do you think you will want or need nursing care in the future? Look at your family's medical history. If your parents or grandparents needed nursing care, you may also need similar care in the future. Do you travel a lot overseas? A lot of us, when we retire or we hang up our hat, we like to travel abroad. If so, you can get coverage for emergency care in foreign countries with a Plan C through G, M, and N. Deciding between Medigap plans. Paying a higher premium for more comprehensive coverage, or pay less for your premium and potentially pay more out of pocket. Let's compare plans A through N. So as we take a look, We see obviously Plan A has the cheapest coverage, and we can go as far as Plan C, which has the most expensive coverage. Now, if we take a look at the most comprehensive plans, those would be the F and the G plans. Those have the most comprehensive plans. So if you're predisposed to things like cardiovascular disease, maybe diabetes, maybe arthritis, or maybe we have family history of cancer or something of that nature, we might want to look at a more comprehensive plan, because as we hit our retirement years, to get hit with a $15,000 or $20,000 medical bill could be financially devastating to some seniors. So having a more comprehensive plan sometimes makes a lot of sense. Here, as we look, Plan G, which is one of the most comprehensive plan, for a female that lives in Lake Forest, Illinois, at 65 years of age, we're looking at $1,284, which is the cheapest, the least expensive premium on an annual basis for the Plan G coverage. Secret number 2, Medigap plans are standard, but the rates are not. Again, we spoke about it earlier on. The government mandates that all plans and services inside those plans are covered equally, no matter what insurance company you choose. The one thing that the government has not done and will not do is mandate what they charge you. And that's where this tool comes into play. Insurance premiums can vary thousands of dollars a year for the exact same coverage. Let's take a look. Female, age 65, living in St. Charles, Illinois. The Plan G highest premium is $3,189. Now, the Plan G lowest premium is $1,284. That's a savings of $1,905. That's a lot of money on an annual basis. Most people who live through using Medigap typically start at age 65, and we all hope to live to at least 75. When we start looking at the numbers, this is a savings of $19,000 over a 10-year time horizon. That's a lot of money to our senior citizens. Let's take a look at a male, age 68, living in St. Charles, Illinois. Plan A's highest premium is $4,785 a year, while a Plan A lowest premium is just $1,116 a year. That's a savings of $3,669. Times that by 10, you do the math. That's $36,000. That's almost a luxury vehicle. Let's look at the couple that are living together, age 65 and 68, living in St. Charles, Illinois. Plan G's highest premium combined is $7,974, whereas the Plan G's lowest premium combined is just $2,400. That's a savings of $5,574, simply because they were able to go into the Lake Forest Public Library, go through Weiss Financial Ratings on a Medigap tool, and shop. How safe is your insurer? Weiss Safety Ratings. A is considered excellent. B is considered good. C is fair. D is weak. And E is very weak. Secret number 3, safer insurers are not necessarily the most expensive. Higher premiums don't mean you're getting coverage from a stronger, more financially stable insurance provider. You can make the choice. More coverage for less. Reduce your premium. Balance the financial safety of your insurer with your choice of plan. The 4 secrets. Medigap plans offer identical coverage. 2, Medigap plans are standard, but the rates are not. Secret 3, safer insurers are not necessarily more expensive. And secret 4, you can make the choice. Weiss Financial Ratings Medigap Report. It helps you make the right choice for you and your specific situation. You can pick the right coverage that's right for you. You can pick the lowest rate, and you can save valuable time and money. You can pick the best and most affordable plan from all available providers, customized just for you. And you get it all for free with your library card because your library subscribes to this very helpful tool. Here are some common questions. Eligibilities for plans C and F. If you were eligible for Medicare after January 1st, 2020, Plan C and Plan F and high deductible Plan F will not be available to you. I just want to repeat that. If you are eligible for Medicare after January 1st, 2020, Plan C, Plan F, and high deductible Plan F will not be available to you. If you are eligible for Medicare before January 1st, 2020, you can continue to enroll in Plan C, Plan F, and high deductible F. At that moment, you're grandfathered in. Consider Plan D instead of Plan C, or Plan G instead of Plan F. The only difference is your $233 Part B deductible. That's the only difference. The coverages are the same. The solution offered by Weiss Ratings Customized Medigap Report is to help you find and select the best Medigap policy for you, with the strongest companies for the least amount of money. Naturally, every person's situation is unique, so you'll have more questions, and we urge you to, 1, talk to your doctor about your future healthcare needs. Make sure that the plan you are selecting will give you the coverage that you need. 2, talk to the insurance company that you've selected to make sure that your specific questions are answered. Number 3, you can also talk to a SHIP, a State Health Insurance Assistant Programs counselor, to get the personalized one-on-one Medicare counseling over the phone or in person to help you further. You can locate a SHIP counselor in your area by visiting the website www.shipacenter.org and clicking to find a local Medicare help. Now, a SHIP counselor can certainly help you on asking you the vital questions in regards to maybe what plans might be most suitable for you. But the one thing a SHIP counselor will not do is recommend a particular insurance company and or a premium. And that is what you'll be able to find here on the Medigap report at Weiss Financial Ratings from the Lake Forest Public Library. How to get your own Medigap report. Go to the Lake Forest Public Library website, lakeforestlibrary.org. Once you go there, click on the Research and Learning button, select all databases, and then you'll see the alphabet across. Just click on a W, and as soon as you click on a W, you'll see Weiss Financial Ratings. Click right on that, enter your library card and PIN if you're connecting from home, or click on the and then click on the Medicare tab, which is the gray bar on the right-hand side. Enter your information and simply download your report. It takes all but 2 minutes to generate, and you'll get a very detailed report based upon your local zip code, your age, and your gender. Because obviously I live here in the metropolitan New York area. Physicians here in New York, they charge a little differently than maybe a physician in a rural part of Illinois. So again, it's very specific to your local zip code. The numbers that are also given to you are pretty much spot on if you're going with a standard healthy living. It's pretty much spot on. You'll never really be off by more than $1 when you call the insurance company, unless you have some underlying issues where now you would be considered substandard, or you might even be able to see a better rate if they would consider you a preferred insured individual. Thank you. Visit the Lake Charles, excuse me. I don't know why it says Lake Charles, the Lake Forest Library website to download your own customized Medigap report, or stop by the reference desk for help. What I'd like to do now is I'm going to take you over to the Weiss Financial Rating page. Can everybody see the Weiss Financial Rating page?
I can.
Awesome. So we're going to slide right over. You know, one of the things that was brought up earlier on today is going through the Weiss Financial Ratings demo. I'm not going to do that, but I'm going to touch on a few things. Some nifty things that are available to you. You have the Financial Literacy Suite. These are all great PDF consumer guides, financial literacy basics, financial literacy planning for the future, and financial literacy, how to become an investor. I would highly recommend looking at some of those programs. They're really good. I mean, you could get everything from, you know, buying homeowners insurance to automobile insurance, everything that you need to know about it. Variable annuities, term life insurance, health savings accounts, long-term care insurance, Medicare supplement insurance. This will carry a lot of features that you'll see there in the Medigap report, but this PDF will not provide you with the specific insurance companies or pricing. You have your Medicare prescription drug coverage, and of course your elder care choices. And that's just one tab of the Financial Literacy Suite. We have another 3 more links that you can go with various PDF books. If you wanted to look for buy, hold, or sell recommendations, we have the Weiss Financial Ratings on stocks, mutual funds, and exchange traded funds. These are very easy to use. The stock of the day is Fortis. These are very easy to use. I highly recommend that you go in and you take a look. And then we have the banks, which is, these are not buy, hold, or sell recommendations. These are just simply recommending the financial strength of these financial institutions that you do business with on an everyday basis. We have credit unions and insurance companies. And then, of course, right next to it is our Medigap. So once we go into the Weiss Ratings Medigap report, we have the first name, last name, email address, the age, the gender, and of course the zip code. Now, one thing I want to point out when we go to the bottom here is we take your privacy seriously. Your name and email address are not collected for any purpose whatsoever. If you prefer, you can enter your initials above. When you enter your email address above, a copy of your customized report will be sent to you. If you would rather not receive a copy of the report, just simply enter ignore@greyhouse.com. Now I'll just go ahead and we'll just put in sample patron, and I will just give, let's see, I'll give my work address, email address here. And we are going to go with 65-year-old female. And what is the zip code there in Lake Forest?
$60045.
45. Thank you so much. So when we're just going to click on get a report here, you'll see it's going to build the report. This should take about 60 seconds to generate. And once it generates, it gives us everything that we need. Now, again, some would say, wow, this is taking a little long. Well, we're going to each individual insurance vendor that is able to do business there in Lake Forest, Illinois, to get the exact dollar amounts for you. So it's very comprehensive. So that's why it takes about 60 to 120 seconds to pull this information up. So I thank you for your patience. And here we go. And we're going to go right ahead and we're going to view the report here. And this is what the report's going to look like. There's our sample patron, a 65-year-old female in Lake Forest, Illinois. We have all of our tabs right here. Again, this gets really detailed on absolutely everything. What does Medicare cover? It gets really comprehensive. Hospital care, what Medicare pays, what we're required to pay, skilled nursing, home health care. It even gets as detailed as abdominal aortic aneurysm screening. I mean, it gets really detailed on all the things that are absolutely covered. What are the gaps in coverage? What we'll wind up paying? It's very, very comprehensive, the report. Now, for us, for a lot of our seniors, we're on TV and we're watching Wheel of Fortune, or we're watching Jeopardy, and we have some of our favorite game hosts, providing us with information on infomercials. And I'm not sure if anybody's, ever seen, Alex Trebek, God rest his soul, talk about Humana. And Humana, which is a nicely rated company, which provides coverage for Medicare. Who doesn't like to hear their favorite game show host talk about coverage and go on? And so what do? We see the 1-800 number, we make the phone call. We're all on a fixed budget as we hit our retirement years, and you start asking questions of Humana, and now Humana comes back and says, well, it's going to wind up costing you X number of dollars per year, or if you don't have a lump sum to pay for it, you can pay monthly premiums. And let's just hypothetically say the monthly premium is $201, and we're getting the most comprehensive coverage. That's something that's very achievable to a lot of people. Now, since we went for the comprehensive coverage and we go to Plan F here, this is what the pricing looks like. And we have our safety ratings right along here. We have our annual premiums, and then we have our monthly premiums. Now, the one company that we had made mention was Humana. So if grandma went on and she purchased a Humana policy and didn't do any shopping, but because the price looked like it was feasible, they just went ahead and they made that purchase. Let's go ahead and here we go. There's Humana Insurance Company, Healthy Living Standard. They have an A rating. Their rate is $4,192 a year. Their monthly premium is $349. Well, if we go ahead, and I certainly want to do this, if the annual is for the Humana is $41.92, let's go. I'm not even going to go with the cheapest of companies up here, but let's go with a company everybody knows. You know what? Let's slide down. Okay, there you go. Blue Cross Blue Shield of Illinois. It's got a B+ rating, so it's right up there with Humana. The annual rate is $1,920, and it's only $161 a month, to opposed to $349 a month. So now what we're going to wind up doing is we'll go ahead and we'll see what the price difference is. The difference is $2,272. So if grandma went on and she listened to a favorite game show host and she figured, I can afford $349 a month, and my favorite game show host is saying that I'll get the same coverage, and we know that Plan F is going to be the same services across the board, regardless of the insurance company we use. If I would have went on and I would have shopped, but I was a little more reluctant, I wanted to go with a company that I've heard of before, Now, instead of going with Humana, I see that we have Blue Cross Blue Shield of Illinois. Everybody knows Blue Cross Blue Shield. I would have saved $2,272 for the year, or from going from $349, down to paying $161 a month. That's a difference of $188 a month. That's groceries. That's a utility bill to a lot of seniors. That's a lot of money just for the simple fact of shopping. And it's not even the cheapest rate. I mean, if we wanted to go up and we wanted to take a look at other companies that had cheaper rates, we could certainly do that too. Some of these companies are just $1,400. Or if we wanted to go with a monthly premium, you have Independence Insurance Company, which is a B-, which is still considered a strong rating. And that's just $1,678 and just $140 on a monthly basis. If we wanted to say go with, let's see, another company that everybody knows, USAA Life Insurance, still saving a lot of money, $2,100 and just $172. And that's got an A rating just like Humana. Now, let's say we wanted to go with USAA. We go ahead, we go to the appendix here, and there's USAA Life Insurance. It gives us the address. It shows us where the domicile state is. There's their telephone number, and there's their safety rating A right there. All of the insurance companies that are available to you in Lake Forest, Illinois, they're all listed right here with telephone numbers, ratings, and the addresses, and where they're licensed to do business. Obviously, they will not show up on your report if they're not licensed to do business in the state of Illinois. Now, with that being said, I would like to go ahead and end this presentation and ask if there are any questions in the chat room that I would be more than happy to answer for you.